those and provide, hundreds of homes rather than dozens of homes, we're just not going to get there.
Jared Kerr from Kiwibank. China has agreed to allow a World Health Organization team into the country next month. Yeah, feel free. Yep, great.
Yeah, and then Aisha, do you want to come around this side? So balance things up.
Oh no, Aisha, okay.
Great.
Okay. Everyone's ready to go? Kia ora koutou katoa and good morning. Can I start by thanking our hosts today, Auckland University, for having us here and for the tour of your facilities and for the work that you have done throughout the pandemic, including, of course, what we've just recently seen on serology and antibody work. We are very, very grateful. I'd like to acknowledge my fellow MPs, Minister of Research, Science and Innovation, Dr. Megan Wood, Minister for COVID-19 Response, Chris Hipkins, Health Minister Andrew Little, and Associate Health Minister Dr. Aisha Verrill. You'll see from some of the words from ministers today that the scale of our vaccination effort means that each minister will be playing a role. I'd also like to thank Director General of Health Dr. Ashley Bloomfield, Chris James from MedSafe, and Peter Crabtree, Chair of our COVID-19 Vaccine Strategy Task Force, for joining us here today. The government is working hard to deliver effective and free COVID-19 vaccines to New Zealanders as soon as they're able and safe to administer. This will be a top priority for us in 2021. Today, it gives me great pleasure to announce that we've signed 2 further advance purchase agreements for COVID-19 vaccines that will ensure we have enough vaccines to cover the entire population of New Zealand and the Pacific, should they want them. We've agreed to purchase 10.72 million doses of Novavax vaccines, which is enough to vaccinate 5.36 million people. And we've also agreed to purchase 7.6 million doses of AstraZeneca's vaccine, which will immunise 3.8 million people. This is in addition to the agreements we've already announced, which were for, as you know, the Pfizer vaccines for 750 people, and enough Janssen vaccine doses for up to 5 million people. These new deals round out our portfolio of 4 different vaccines. We've secured vaccines across 3 different technology platforms to ensure we have diversity across the types of vaccines available. We've secured sufficient vaccines to cover the realm of New Zealand, Tokelau, Niue, the Cook Islands, and our Polynesian neighbours, Samoa, Tonga, and Tuvalu, should their governments wish to take these up. We're working very closely with Australia, who are also looking to support vaccination across the wider Pacific. Our approach allows for the possibility of some vaccines being more suited to certain population groups or for deployment in different areas. I also want to again reiterate that COVID-19 vaccines will be free for everyone who wishes to be vaccinated. We are moving as fast as we can, but we also want to ensure the vaccine is safe for New Zealanders. All of these vaccines still must pass MedSafe approval for use here in New Zealand. As you all know, some countries are granting emergency use authorisations ahead of the usual clinical assessment and approval process. That's in response to the public health emergency that is gripping their nations. Unlike in New Zealand, they face widespread community transmission of COVID-19 and a rapidly mounting death toll. For example, the UK's emergency authorisation to use the Pfizer vaccine only allows targeted access for specific at-risk groups, rather than authorising vaccines for their wider population at this stage. Canada also announced last week that it had issued conditional authorisation for the Pfizer vaccine for use of those aged 16 years and older, again because of their public health emergency. The US Food and Drug Administration also issued emergency use authorisation in the past weeks, and vaccination started there this week. We are obviously in an entirely different situation here. MedSafe, however, is undertaking rolling applications for COVID-19 vaccines, which means they can submit data as it is completed and ready for assessment. This may enable faster approval by MedSafe, but with the same rigorous level of scrutiny that all medicines undergo in New Zealand. It's also important to remember that there is a huge global demand for COVID-19 vaccines. Manufacturers can only produce and ship doses so fast. Nonetheless, we still expect to receive vaccines in good time, with a good portion of our doses expected to arrive beginning in the first half of next year, but into the second half. Our first priority here will be to vaccinate border workers and essential staff in order to further reduce the risk of COVID passing on to the community. We expect vaccines to be delivered to our frontline workers in the second quarter of 2021. Keeping in mind, of course, we still await the data to demonstrate the effectiveness of the vaccinations that are currently being developed in reducing transmission between people. Never before has the entire globe sought to vaccinate the entire population at the same time. Ours will be a sustained rollout over months, not weeks, but our pre-purchase agreements means New Zealand is well positioned to get on with it as soon as it is proven safe to do so. It will be New Zealand's largest immunisation rollout ever. Most countries are factoring the rollout to take all of 2021 and some of 2022 to complete due to its scale and complexity. So we are all in a similar position. Before I hand over to Minister Wood, a brief comment on timings and also the amount of vaccine we have. Much is unknown. Delivery dates are not guaranteed. Some vaccines we have agreement with may not prove successful. We, for that reason, have created a portfolio to ensure we have backup provision. If these backups are not required, they will still not be wasted. It's why we're working with other countries on ensuring that vaccines are potentially able to be either on-sold or, of course, donated into other regions or areas. On the rollout, it's not the date that we start that matters, it's the date that we finish. While some countries have already started, it is expected that many countries will only finish their vaccination campaigns in a similar time frame, and New Zealand in that sense is no different. Look, I'll now hand over to Minister Wood. Then I believe Minister Hipkins has a few words, and then we'll finish with Minister Little and open to questions.
Thank you, Prime Minister, and kia ora koutou, everybody. It's good to be here. As the Prime Minister has just announced, we've signed 2 further advance purchase agreements to secure COVID-19 vaccines. I'm just going to talk through a little bit more detail on the purchasing strategy that surrounds that. So we now have agreements with 4 vaccine developers for COVID-19 vaccines. Our 4 purchases are complementary and have been deliberately sought for their diversity across COVID-19 vaccine technologies. With the addition of the 2 purchases today, New Zealand now has access to vaccines across 3 different technology platforms. We have the RNA through the Pfizer vaccine, a viral vector vaccine from Janssen and AstraZeneca, and a protein subunit with what we've announced today with the Novavax candidate. By ensuring that we have access to multiple types of vaccine, we are making sure that we have the right options when vaccinating people in New Zealand. Our purchasing strategy was deliberate and has meant that we have not put all our eggs in one basket. We are addressing the potential risk that some vaccines may turn out to be unsuitable for us here in New Zealand. And I think one of the things that we're all seeing across the world, that vaccine development is a very fast-moving space when it comes to the COVID-19 vaccine. And we are constantly looking for new information to help us make the best decisions for vaccine purchasing and immunisation planning. We're confident that our 4 agreements that we have in place put us in a really good position, but we are not ruling out other purchases if required. We've drawn on a panel of New Zealand's top vaccine experts to assess options for purchase to ensure our portfolio gives us the best chance for success. And we will continue to use scientific evidence and advice to help inform how we roll out the vaccines. And I would like to give a special thanks to Peter and the task force who have put together this purchasing strategy, working with colleagues across health and MedSafe. Because earlier this year, when we announced our COVID-19 vaccine strategy, its mission was to secure safe and effective COVID-19 vaccines for New Zealanders. With the 2 purchases that have been announced today, we can have confidence that New Zealand is in a good position as we enter next year and the year of vaccination. Thank you. I'll now hand over to Minister Hipkins and Minister Little to provide further information on next year.
Kia ora koutou. Good morning. As you can imagine, the Prime Minister has already said this will be the largest vaccination campaign we've ever undertaken in New Zealand. It's going to require a huge logistical effort, and planning is already well underway to make that happen. Administering what could be a number of different vaccines at the same time that require different technology will also add to the complexity of that challenge. One of the first challenges that we've had to already begin to address is that the Pfizer vaccine, the one that we are expecting to arrive in the country first, needs to be stored at minus 70 degrees Celsius. I can confirm that we have ordered additional freezers for that and that they are on the water on their way to New Zealand at the moment. They are expecting to arrive in New Zealand waters in the next 72 hours, although I understand that they won't actually be coming portside until New Year's Day, given the delays unloading at Auckland. I'm advised it will take about 4 weeks to have those installed. They will predominantly be here in Auckland. Some will be sent to Christchurch. And then the distribution technology, the work around making sure that we've got the distribution technology right, is also proceeding at pace. We also need to be able to track and trace the use of the vaccines. So we have invested $23 million as a government in the National Immunisation Solution. That will do a number of things. It will ultimately replace the current National Immunisation Register, so it will record who's had the vaccine, when they had the vaccine, and for the double dose vaccines, when they received each of their doses. But it will also help us to manage our inventory. So it will record vaccines as they arrive, where they've been distributed to, and so on. It will also help us to track the use of all of the consumables associated with the vaccination campaign, and we have ordered plenty of those as well. So we have all of the consumables that we think will be needed, including additional PPE, syringes and so on order. Some of them have already arrived in the country, and they'll be arriving in the country progressively over the next few months. The final piece of the puzzle is making sure that we have people ready to do the work. We have around 12,000 people are currently trained to administer the vaccines, and we'll be working over the next few months to increase the number of people who are available to support the immunisation campaign. We particularly want to focus on diversity within the workforce to help us get into the diverse populations that New Zealand serves. So logistics are going to be big. I can give you a reassurance that that work is already well underway, and it will be continuing at pace over the holidays as well. Thanks. And I'll now hand over to Andrew Little.
Thank you. I appreciate time is running on, and we want to get time for questions. So just 3 points I wish to make. First of all, as my colleagues have said, indeed the Prime Minister has said, this will be one of the biggest vaccination campaigns that we have run in this country, and in the time frame in which we're doing it. So getting coverage and getting the reach that we need for this to be successful is going to be absolutely vital. It will be very much community-based and community-driven. What's very important for a health system that struggles to deliver equitable access at the moment is making sure that those population groups that don't necessarily enjoy the best of access to our health services, they get covered too. So we'll be reaching out to, for example, kaupapa Maori health providers, Pacifica health providers, to make sure that those populations are covered. The second point I want to make too is that there will be some who will have early access to the vaccine, that is to say once it is approved and ready and available and viable, we need to make sure that, for example, those working at the border and coming into contact with those coming from overseas, where there's a risk involved, they will be eligible for vaccination very early on, as will other at-risk population groups as we roll out the vaccination program. So there will be a level of sequencing. The third point I just want to make too is that having the vaccination will be voluntary. We won't be regulating or making it compulsory. It will be voluntary, but we will be sending out some very strong messaging about the importance of it. In the end, this is about keeping all of New Zealand safe against this tricky virus, and we need to make every effort to do that. So on that note, I'll hand back to the Prime Minister, who will field questions.
Great. Thank you, ministers, and of course anything that requires an answer from a medically trained individual will be directed to Dr. Birrell. Look, we'll take questions specific to the vaccination announcements today, and then if there's anything else, we'll just break briefly, let those who have joined us from Auckland University go back about their business, and then we can pick up any other topics of the day. So let's kick off.
As the Pfizer vaccine's the one being rolled out overseas, are there any concerns that that's one we've purchased the least of?
Oh, well, look, as you will see from the portfolio, we are ensuring that we will have enough vaccines for every single New Zealander who wants one. Pfizer, of course, as first cab off the rank, is in very hot demand. No country currently has enough vaccine from Pfizer to cover their entire population. Every country at present is prioritising those who are at greater risk. For New Zealand, that means border workforce because they are most exposed to the virus at present.
The rollout was initially talked about as being in the first quarter, by the end of the first quarter, and now you're saying maybe starting the second quarter.
No, we've said exactly the same thing. We've said that the Pfizer vaccine is expected to arrive or be available within the first quarter. What we're highlighting, as we always have done, is that no country in the world has the expectation of having enough vaccine available to vaccinate their entire population in the early stages. Everyone is rolling out a campaign because of the availability of vaccine. So as you will indicate, we still have expectation in that first quarter for the beginning, but it will carry across 2021 for that campaign.
So that
Minister, sorry, just
you finish, Chloe. We haven't been specific because we are reliant on the drug companies' delivery dates, and so we've kept it general around in the first quarter because of that.
And are we locked into Pfizer? So you're obviously getting the logistics, the freezers, that kind of thing. Are we locked into definitely getting Pfizer, or?
What do you mean by locked into Pfizer?
Well, could we end up getting a different vaccine and not even seeing Pfizer?
So our absolute expectation is that we will be receiving 750,000 doses of the Pfizer vaccine, small portion beginning in that first quarter and then progressively over the course of the year. What we've done to ensure that we have coverage of the whole population, though, and that we're also prepared that if some of the vaccines do not prove to be successful, we have an insurance policy by buying across different types of vaccine technology.
Just in terms of the availability of Pfizer, addressing that of course Pfizer is now also negotiating for distribution through the COVAX purchasing, the multilateral purchasing agreement. So that is in the coming days and weeks that those conversations should be concluding, and New Zealand, as well as going through bilateral arrangements with individual pharmaceutical companies, also entered into the multilateral arrangement around COVAX.
And does that affect the timing for New Zealand?
Those talks are concluding in terms of Pfizer has made a priority fulfilling the advanced purchase agreements like the ones that it has put in place with New Zealand and its obligations into COVAX. But in terms of whether timings, when any availability through the COVAX mechanism, that will be concluded in the coming weeks.
Given that the vaccines haven't all been signed off, what is the plan if
You mean in terms of MedSafe approval?
And international regulatory approval. What is the plan if one or two of these are not signed off, if they do run into problems?
And so we have anticipated any risk that there might be around the availability and delivery of vaccine by ensuring that we have a portfolio. So you'll hear that we actually have more than enough currently with our purchase arrangements. That's because we are still in the process of seeing the final outcomes for some of these vaccines. So if one falls over, we have other options available to us, and that's been a very big part of our strategy.
So that's enough for New Zealand and the Pacific?
Yes, across that portfolio, should the Pacific choose.
Just another question about the logistical challenge posed by Pfizer and the whole program. How many more health professionals do we need? How many more nurses? Because it's not just going to be the administration, is it? It's going to be the transportation.
Yes.
Making sure everything's kept. It's a massive chain.
It is.
In terms of administering.
It is.
How many people do we need? Who are we short of?
Look, it's going to depend a bit on timing and logistics. So it depends on how many vaccines we might be aiming to get out there in a short space of time or a longer space of time. And at this point, we still don't know the exact sequencing of the arrival of the vaccines. But we will certainly be looking to make sure that we can make the best use of the people who are already available to do vaccinations. And so, and that will have a timing impact as well. And then, of course, we're looking particularly, I think, as Andrew Little already mentioned, we're looking particularly in those population groups where amongst our trained vaccinators there might be underrepresentation because we know for a whole variety of reasons that will help us with the level of trust and confidence that we can build in the vaccination campaign.
If I could just add, I'll come to you in a moment. So we currently have 12,000 people across our health workforce who are able to be a part of our vaccination program in terms of administering vaccines. What we want to do is see whether or not we can support other members of our health workforce to be trained in time to be part of the rollout of this campaign also.
Are you expecting this to be a one and done, or is the government prepared or preparing for this to be an annual effort?
Well, look, right here we see research underway to determine how long the antibodies around COVID-19 last for. So this is an area where it is still a bit of an unknown. We're, of course, working through making sure that across 2021 we have a vaccination program. And then I anticipate that over the course of the year we'll have more information around when we may need to enter into future vaccine programs. Perhaps Dr. Verrill might like to say something further on that.
Strictly speaking, the duration of protection that a vaccine has, that we can be certain of, is the duration that people have been followed up in the clinical trials. And so obviously at this stage, with COVID only being in the world, it's a short period of time. But that evidence will continue to emerge, and that will inform the ongoing vaccination strategy beyond then. Obviously there'll be new cohorts entering our population, young children, migrants, so there always need to be some form of ongoing vaccination activity for COVID-19.
What percentage coverage of vaccination would you like to see by this time next year?
Great question, because actually it will depend. Of course, we want our entire population to be protected from COVID-19. And of course, in a vaccination program, what you're looking for are enough people who are vaccinated to mean that that transmission around the community and people becoming sick from COVID-19 is dramatically reduced. That question of how many it will take, though, really depends on how effective each vaccine is. Some are reporting as high as 90% plus effectiveness, some are lower. So depending on which vaccine we are rolling out will depend the percentage of the population. The simple answer right now, though, is as many New Zealanders as possible. We want to be involved in this vaccination campaign. It's not just about protecting other people, it's about protecting them.
And is New Zealand at an advantage because we're not having to do an emergency use situation?
I'd say New Zealand is certainly in a good position. You know, we don't have widespread community transmission, so unlike many countries that are seeking emergency approval for the rollout of their vaccine, we will be going through a process that allows us to get that extra layer of reassurance from MedSafe that the vaccine is safe and ready to roll out.
How far down the MedSafe process are you in terms of the Pfizer vaccine? Where is that at in the MedSafe approval process?
Well, look, I'm not sure how much specific detail I'll get into, but talking in general terms, MedSafe have made themselves available to receive data from pharmaceutical companies straight away. Rolling data can be provided. MedSafer also indicated they're in a position to assess multiple vaccines at the same time as that data is coming in. So it's a rolling process, unlike what you might see in a more conventional time frame. I'll come to Maori TV if I can.
We understand that people demographics were hit hard this year.
Yes.
Are there specific targets for Maori and distributions?
Of course, we want to ensure that there's trust and confidence in every community, including our Maori communities around the vaccine, so that we can get really good coverage. We are concerned that there are populations within New Zealand who, if they have COVID-19, are more gravely affected than others, which is why it will be important that we are working closely with those communities to ensure that we have a successful vaccination campaign.
Rural New Zealanders doesn't have the same access, so how are you going to ensure that you help all New Zealanders?
And that will be critical. So built into all of the work that we're doing around logistics is making sure that regardless of how difficult it might be to store and keep the vaccine, that we are reaching everybody, because we must reach everybody. And that means those in rural communities, those who might be more isolated, those who might have access issues, they might have a disability or be an older citizen. We're building into our program how we make sure that we meet everyone's needs.
Maori just on primary care have been protecting people from this deadly virus.
Yes.
To ensure that they're going to be getting these vaccines.
You'll see from our plans that at the moment our focus is on ensuring those who are currently at the most risk of being exposed to COVID-19 we cover first. So that includes our border workforce, it includes those working in our managed isolation facilities. From there, it's our intention to then work into the health workforce who might be exposed as well.
Minister Jacobs was talking about some of the logistical challenges with the delivery of freezers, etc.
Yes.
Delays. Are you concerned that any of those additional items required for the rollout of a vaccination program could be caught up in these port delays we're experiencing, or is there any way to fast track delivery?
No, not concerned that will lead to delays. Of course, as you've heard, even taking those into account, we're expecting arrival dockside in the new year, and whereas actually the vaccine we're not anticipating for some time after that.
What steps have you taken around transporting and administering the vaccine, or some of the vaccines? Can you give us any idea of what that is going to look like for rural communities or communities where there isn't easy access to a doctor's or a hospital?
Yeah, do one of the ministers want to pick up the rural community question?
So one of the issues that we'll be working through is that whilst the vaccine needs to be stored at an ultra low temperature, there will be a period of time where it can be transported at a not quite so low temperature in order to get it to where it needs to be going. And so we'll look at having mobile vaccination clinics moving around the country to access those areas where it might be more difficult. There'll be progressive release of the vaccines rather than releasing them all at once, for example. So there are a whole variety of things we can do from a logistical perspective to make sure that we don't have vaccines expiring on the shelf, if you like.
We'll take a last couple. But one thing I do just want to add that think about the way that we've rolled out community-based testing. That's an example of the kind of model where we want this to be very accessible for people to know where they need to go. And we're also thinking about sequencing the timing in such a way so there's good familiarity across the community around when it is and where it is they can go for their vaccine. So we're building all of that into our planning. I'll take the last couple, unless you don't want general questions.
What steps have you taken to ensure that the equipment needed for the to support the vaccine rollout isn't delayed at the ports?
Look, I appreciate that the Minister shared that extra layer of information. We have no concern, though, that is causing any issue for us. Because, as I've said, they're coming in January. We're not expecting the vaccine for some months after. So, look, I will move to general questions. So, anything further on vaccine? It's all right, everyone. I'm not going to walk out on you.
Just on the rollout.
Yeah, that's fine.
There are problems this year with the flu vaccination rollout. There's been problems with the measles catch-up campaign.
Yep.
What specifically is being done to change the way we carry out immunisation to make it better?
So a couple of things specifically on what we've seen before. We have in the past had a decentralised way of distributing vaccines across New Zealand, and they've also often been administered via private provision. We are, of course, here. This will be a very rigorous centralised program. You've already heard we'll have the ability to track where our vaccines are across the country. We'll also have a national health immunisation register. Previously, that hasn't been available in New Zealand either, which is a big problem for the measles catch-up campaign. We have a whole period of time where New Zealanders' vaccines weren't logged appropriately, and we just didn't know if they were vaccinated. So we have overcome some of those major issues already with technological improvements and centralisation. Should we move to general, given I've been completely abandoned now? Should we move to some general questions?
May I please get an update on Uhumātao?
Oh, look, as I've said for this week, at the time that we have information to share, we will share it.
So it could be this week?
Again, at the time that we have information to share, we'll share it.
Waitea Radio News had already published this morning that there was going to be an update today. We've already spoken to the Office of Waikato Tainui following the settlement that was signed on Monday. What's your understanding, I guess, on that process?
And look, as I've said, in terms of the process, you'll know that we've been working for months, over a year, on trying to find resolution to Uhumātao. It has been an issue where there have been multiple parties, multiple issues that we've needed to try and resolve, but when it comes to the final outcome, you'll know it when you hear it from us.
Seoul have also been campaigning, I guess, for it to be left as a public reserve. Under your portfolio last year in regards to the history of Uhumātao.
Yeah.
What's your view on that?
So look, yes, I've certainly heard the representations of Seoul. I've also heard the representations of some mana whenua who wish to have housing for their people on the land also. And that's actually really at the nub of some of the issue. There has been differing views around the future land use at Uhumātao. My final word on that, though, would be to say a word of thanks to Kingitanga for the role that has been played in bringing those parties together to try and find a solution.
Has it been challenging in that regard?
Absolutely. But I do think that there is a role for the government to play in supporting the King to find that resolution. Ultimately, a dispute that is left to be a dispute takes us nowhere. A resolution was needed, and I think that there was a role for us to play in that.
Did you watch the select committee that Speaker Trevor
No. Unfortunately, I did not. It was a very busy day yesterday.
And do you still have confidence?
Yes, I do. I've certainly heard the reports from the meeting.
Sorry. Are you comfortable with Trevor Mallard revealing he knew almost immediately that his accusation was false?
Again, referring simply back to his own words, he himself gave an explanation around that. I can do no better than refer to that because, of course, only he will know the details of what went on in the aftermath, but he himself has acknowledged that even then it was an employment dispute at that point. So that was the explanation he's given.
But it's taken 18 months for an apology. Are you satisfied with that?
Also, I understand that regardless of the timing of when he may have wished to give an apology, at that point it had become a legal matter. So again, only he will know the ins and outs of that process.
And what are your thoughts on this becoming a distraction from sort of the actual contents of the review and sort of the people who came forward?
I don't think any of us will lose sight of that. Ultimately what triggered this entire issue, for which the Speaker has rightly apologised, was the very real work that needed to be done around making sure Parliament was a safe workplace, just like every workplace should be. And I don't think, regardless of this, that it has distracted from the importance of that work.
But given his role, his leadership role in Parliament, are you satisfied with the fact that he didn't correct something immediately when he could have? It was
Again,
a 24-hour window, regardless of what else was going on. Isn't he sort of on about in a way to actually address some pretty...
Again, he has given the explanation that at that point it had become an employment dispute.
Should have asked this before when everyone else was.
Oh, absolutely fine.
In terms of those people who are getting emergency vaccinations in other countries, would New Zealand look at changing MIQ requirements for those coming into the country who may have been vaccinated?
A really good question. This is something that we will only be able to answer over time. So for now, of course, our expectations is that we'll be keeping our restrictions in place until we have a vaccination campaign that provides protection for New Zealanders. We may, over the course of the year, see evidence and data that can reassure us that those who are vaccinated are not at risk of being a point of transmission. We don't yet have enough data to prove that to us, and so at this stage we wouldn't expect to change the requirements.
So people who've been vaccinated overseas will have to spend 2 weeks in MIQ?
At this stage, but I wouldn't be surprised if we get over time the data and evidence required to potentially change that regime. But for now, it's still inconclusive as to whether or not being vaccinated means that you don't pass on COVID-19, which may surprise people. It will take us a little bit more time to get that information. Okay, shall I just, yes, go ahead.
So just sort of connected,
Yeah.
border closures. So if we're not all vaccinated till the end of 2022, if all goes to plan,
Yeah.
does that mean the borders will stay closed and likely until that time?
Yeah, look, you won't see a change in our border regime until we have confidence that the border no longer poses a risk to New Zealanders. So either that will mean that we've had widespread vaccination, or we have enough data and evidence and a regime that shows us vaccinated individuals entering the borders are no longer a risk. So those will be the two factors that will potentially change the way our borders operate. I'm going to leave that. You can have the last question.
Oh my goodness.
Make it a good one.
Nanaima had confirmed $75 million for Pacific response
Yes.
in terms of COVID and the vaccine.
Yes.
What does that look like, and when are we expecting those rollouts?
So you'll have heard that we've already factored in purchasing vaccines for the Pacific in the arrangements that we have. So really now it will come down to making sure that the vaccines are appropriate for the population, that it's logistically possible to ensure a rollout of those vaccines, and also, of course, that is what our Pacific neighbours want. Okay, great, last one. Oh, I'm a little bit late.
The New South Wales cases?
Oh, we won't do a walking track. Just to note in the cabinet papers, it says, of course, that
actually breaks up that monotony of having working from home. So you can sort of see two sides of that argument in terms of the benefit that brings from a different working environment and a different place to base yourself.
Thanks, Nick. Now, Kate Top of Vodafone, tell me what's happening at your company with this.